All right, today we're diving into one of the most misunderstood and, frankly, controversial conditions in modern psychiatry, dissociative identity disorder, or DID. But we're not just going to talk about what it is, we're going to tackle the why. Why is a condition this severe so often brushed aside by the very professionals who are supposed to treat it?
This right here, this is the central question we're digging into. It's a real mystery. How does a disorder with such life-altering effects get pushed to the very margins of psychiatric care? Well, as you're about to see, the answer is a whole lot more complicated and surprising than you might think.
So before we can really unpack why DID gets dismissed, we have to get on the same page about what it actually is, according to the source material we're looking at.
Let's be really clear here. DID is incredibly serious. The source puts it at the most severe end of what's called the complex trauma spectrum. So this isn't some mild issue. We're talking about severe difficulty with just functioning day-to-day, a high likelihood of other co-occurring illnesses, and a really significant risk for self-injury and even suicide attempts.
Okay, so if it's that severe, that brings us right back to our main question. Why in the world is there such a strong push to just dismiss it within the medical community?
And this is where things get, well, pretty startling. The source points out that some clinicians can literally choose to dislike the diagnosis. I mean, think about that. Can you imagine a doctor refusing to diagnose or treat cancer because they just didn't like it? It would be completely unheard of. Yet the source argues this is exactly what can happen with DID.
So where does this professional dislike even come from? Well, the source points to a few things. There's a ton of misleading information out there that creates prejudice. There's also professional self-protection. And then there's this fascinating idea of a cultural dissociation. Like, as a society, we collectively turn away from the brutal reality of the severe trauma that causes this.
Now, those reasons all sound plausible, right? But they might just be the tip of the iceberg. The source argues there's a much bigger, hidden incentive to look the other way, and this one has less to do with personal beliefs and a whole lot more to do with the system itself.
And this is where we start to follow the money. Because, as it turns out, a lot of this dismissal boils down to a core financial argument.
And here it is, the elephant in the room, money. A huge, though often unspoken reason that the system might encourage these dismissive attitudes is that the treatment that actually works for DID is seen as just way too expensive to be practical.
This comparison really lays out the challenge perfectly. Look, for other severe disorders like schizophrenia or bipolar disorder, treatment often leans heavily on medication and pretty standard protocols. But with DID, medication really doesn't do much. The effective treatment is specialized long-term psychotherapy. We're talking years of work, and recovery is rarely a straight line. It's just incredibly intensive on every level.
And that high cost creates this huge domino effect. Since DID doesn't fit neatly into the typical medication-focused model, it often gets left out of psychiatric training altogether. The problem gets punted over to other fields, which creates this cycle where new generations of psychiatrists aren't even trained to spot it, let alone treat it.
So on the surface, this all sounds like a cold, hard economic choice, right? The treatment costs too much, so we don't do it. But what about the costs that you can't see on a spreadsheet? This is what the source calls the shadow cost.
And that brings us to the most important question of all. We can see the price tag for treatment, sure, but what is the actual price we all pay when we dismiss this and provide no effective care?
And the source argues this shadow cost is just massive. It's the cost of a person's life being derailed by continued suffering. It's the cost of endless emergency room visits for self-injury and suicide attempts. It's the cost of more long-term physical illness and, tragically, a shorter life. And the trauma doesn't just stop with one person. It can echo across generations. The bottom line is, whatever money is saved in the short term gets absolutely wiped out by these devastating long-term costs.
So here we are staring at two massive bills, the high cost of treatment on one hand and the crushing hidden cost of neglect on the other. So what does the evidence tell us is the responsible path forward?
The source lays out a really clear, evidence-based plan. First, actually use the established diagnostic tools we already have to get an accurate diagnosis. Second, provide the specialized therapy that we know works. Third, and this is huge, invest in actually training clinicians to do this. And finally, do an honest accounting. Really compare the cost of treatment side by side with the true societal cost of doing nothing.
And this brings us to the final, crucial takeaway from the source material. When you actually do the math,
When you factor in everything society pays for untreated complex trauma, providing the right treatment up front isn't just the compassionate thing to do. It might actually be the most economically sound decision, too.
And that leaves us with this final thought to chew on. The debate isn't really about whether we can afford to treat DID. The real question is, which cost are we, as a society, choosing to bear? Is it the upfront investment in healing someone, or is it the long, devastating, and hidden price of neglect?